Okay, yeah. So we're aware that in rural areas, there's a prevalence of the human papilloma virus infection, and we've noticed that there's a high mortality rate, and it's been a concern, a public health concern, and also some studies conducted in north central Nigeria has reported a high prevalence of HPV amongst women with HPV type 16 and 18. And I'll just tell you a little story about how we decided to focus on rural communities, rural health, and rural promotion. So since the start of our charity, we've lost about 3 women to cervical cancer, and they all reside within the rural communities. The reason being that um, they have no clue what human papilloma virus is. Obviously, I do not blame them because of the environment they found themselves in. They later found out that it was cervical cancer when it was getting to the end stage of their life, and nothing could be done about it. And so we took it upon ourselves and said, okay, since most of the cases are based in the rural and the in the suburban and the urban communities, and they are being looked after, why don't we focus on rural health and bring the awareness to people within the rural communities? And the pictures, most of the pictures attached to this discussion or presentation are pictures as a charity we've gone to talk to people, educate people, and also create awareness. So also maternal mortality remains alarming high in rural communities in Africa, using Nigeria and Ghana as case study. And also there's urgent need for interventions to address um, these related diseases and maternal mortalities. Hence the reason why I've gathered us all here to have a discussion and how we could bring help to people in need. So this is a map of Africa by I'll try to pronounce the name, Okoromade in and his colleagues in 2022. And if you look at this map clearly, you will see that cervical cancer is predominant in most of the African countries. You see it in West Africa. I've circled them, so you see them in West Africa using this map. In sub-Saharan African countries, you see that cervical cancer is still of increase within those countries. And this is countries with the highest maternal mortality rate as of 2020. And for instance, in South Sudan, you have a high mortality rate of 1,223. And this high mortality rate is deaths per 100,000 live births. So imagine how many mothers we lose to childbirth every year within the African setting, within the rural setting, even within the global setting as well. So we've realized that rural communities globally face significant health challenges, which leads to disparities in disease prevention and everything. And then to address these challenges, I've said to myself that there are different approaches we could use to address these challenges. One is to combine education, technological innovation, policy policy reforms, and community-driven solution. Because what I intend to do with this discussion is to explore the barriers to healthcare access in rural areas and create strategies for HPV prevention and maternal health care. So we have the different barriers to healthcare access in rural areas. Now, these are our volunteers from our charity. They left their urban areas, and then they are going to a rural community, and this rural community has no land, so you have to put the motorbike in a boat and take the awareness campaign to the people there. So from there, you realize that rural populations often struggle with accessing timely and adequate healthcare due to several factors, which includes long travel distances to healthcare facilities. You have poor road networks, as you could see, and then it's so bad that you have inadequate healthcare structures. And also, most importantly, they shortage of healthcare professionals, fewer doctors, nurses, and specialists in rural areas, which is actually a big problem. And then we have even the healthcare providers that decide to give their time, their resources, and everything. They are still overburdened, and that can lead to poor service delivery. Also, we have high turnover rates due to lack of incentives for rural posting as well. And we also have the economic and the social cultural barriers. We're not going to leave that out. And we have limited preventive healthcare services. We have limited access to healthcare services. And in a situation where you have emergencies, um, where you don't have access to good healthcare facilities, not just the rural healthcare centers we have in the different communities, where you don't have access to good rural healthcare facilities, you realize that that could lead to risk of complications like postpartum hemorrhages and death as well. And it leads to no access to pap smear. I've been having a discussion with some girls that I talked to. And then I realized that even the girls that reside in the suburban and the urban areas haven't heard of pap smear, haven't heard of the HPV vaccine. And the only STDs they are aware of is HIV/AIDS and gonorrhea and syphilis. And they are not aware of HPV vaccines. And then we also look at the cultural and social barriers. So from what we've realized as a charity is that if we want to get to the people, we go through either their religious leaders or we go through their chiefs and the people they hold in high esteem, basically. So because traditional beliefs and stigmas around reproductive health also prevents women from seeking health care. So now, what is our role of education in HPV prevention? We need to look at community-based health education. We need to look at integrating HPV prevention into primary health care. And we need to also look at engaging local leaders and influencers as well. So the top screen is the rural community we went to. Although we are targeting HPV and maternal mortality. Also, this is a rural community in a state in Nigeria. This is the water they use in bathing, they use in cooking, they use in drinking and everything. So, and then this is us taking some blood samples and running some tests to make sure that people within the rural community have access to all these basic amenities. So what we intend to do is expand access to skilled birth attendants. Now we've realized that within the rural communities, there are women they go to. So you hear stories like, oh, the baby is breached and they cannot go to the hospital. And because they cannot go to the hospital, what they do is they go to these midwives that for lack of a better word, they would say, we are turning the baby's head, we are turning the baby's neck, just to make sure that the baby is not breached. That way, in some cases, you hear people telling you, oh, it's really good. And in some cases, you also hear others telling you that it leads to a lot of complications and everything. So what we are doing is we are training and deploying not the midwives, but the traditional birth attendants that are residing within the rural communities. So we send our trained personnel there to actually train them and add to the skills they already have. And then in situations where it's out of our hands, we encourage hospital delivery. So we try to get some hospitals that would probably subsidize the maternal health care cost for the people. So currently, we are looking at equipping rural health centers with essential maternal and neonatal supplies, and also establish community-based blood donation just in case of emergency. Also, here we are talking to although most of them are elderly women, but we are also educating them about family planning and prenatal care so that they could also educate their daughters, their teenagers, and also providing free and low cost contraceptives and prenatal vitamins. So we intend to start using the mobile health units. So like a mobile lab, just the way you have the mobile toilet. So like a mobile lab, to bring antenatal services to those remote communities. So what we are doing is after we are done training the traditional birth attendants residing within the remote community, because if we're being honest with ourselves, it's going to be a very difficult task bringing the trained midwives and nurses from the urban centers to reside in the rural communities. So since we have the traditional birth attendants, what we do is bring the midwives that have been trained from the suburb or the urban area, and then let them train the traditional birth attendants and provide them the necessary requirements they need. And also, we are strengthening male involvement in maternal health to promote family intervention and to promote family support. So recently we had a program called Hack Health. That was in February. What we did was to promote the importance of telemedicine within the rural community, and also to promote the importance of data analysis, data collection, to make sure that we are not that the rural community is not left out. And we also talked about point of care diagnostics tools, where we had some of our volunteers come up with great technology ideas, great community driven innovations that we are currently trying to work on to help those women within the rural communities. And also try to get community-based health workers as well. But currently, like I said before, it's been quite challenging. So what are the policy changes and interventions that we have set up and that I have also set up to bridge healthcare disparities? So we intend to sustainably improve rural healthcare by making sure that our policymakers must try to adopt to comprehensive reforms, strengthen the rural health system, and also we've realized that fundings don't really get to the rural health facilities and the workforce training, and that destabilizes them as well. So as a charity, we intend to look for partnerships. We intend to seek fundings for rural health facilities and workforce training to make sure that the people that need this to make sure that the people that need this are given the right health care they deserve. Also, we intend to implement a universal health coverage to make the service affordable, sorry, and also improve transport infrastructures. This has been quite difficult for us, but at the end of this meeting, with like minds like yours, I think we could make the rural community benefit from rural health care development. And then we also try to provide free cervical cancer screening, which we've done in different rural communities within the state. And so far, our recent concluded one, we tested over 70 women of the HPV virus, and we had about 4 of them that were positive for the virus. And also we've had some maternal health emergencies that we've referred to some of the hospitals we are partnering with. And also we support public and private partnership and global collaboration, and also partner with non-profits and international organizations to fund especially rural health programs. I keep saying rural health programs because that is where my passion lies. Basically, all I do is to make sure that the rural health gets the rural community gets the help and the benefits they require, and then they are not left out from their suburban and non-rural residents. And then we try to provide corporate investment in telemedicine and mobile clinics. We have professionals on board for this as well. And we are also leveraging international research and funding to help address these healthcare disparities. So I'll just walk us through our GIRIF project. It's called 300 SHE LDS. So the LDS stands for Lifeline Defense and Support for Women's Health. So we've come to realize, like I've walked you through, that women face significant health challenges. So what our project is all about is we are proposing to address these pressing issues through a comprehensive approach to women's health. And through this project, we are replicating a model for comprehensive women's health to support women. As we are starting, so the 300 is our goal. So if we are in a rural community in Rivers State, the goal is to get to 300 beneficiaries to save them. So what this entails is we have a project where we are looking at giving different maternal kits to pregnant women, which will contain prenatal medications, everything for women living in the rural communities. And then also the other one, which is so 150 for the pregnant women, and then 150 for our girls, women that reside in the rural community to also get screened for the HPV virus. And then we are taking it further to make sure that once you're screened for the virus and you are positive, there is a step-by-step process we follow to make sure that you get all the necessary help you need. Because I've realized that what most individuals do is when you go to do a sensitization program, let's say you're checking the eyes, the ears, and everything, and then when you're done, even if the person has the pressing issue, because you don't take it to the next level, the person still remains with whatever diagnosis you've given to that person, and that also limits some people as well. So this is our project, and if you are interested, I could walk you through the project and I could send you the proposals already. We've submitted the proposals to different bodies as well. So this is our rural health sensitization program. I'll just play some of the videos for us to watch. Thank you. So we're taking a bike to the rural communities, and this is our volunteers going to the rural communities to make sure that they get the necessary help they deserve, and also making sure that everybody gets everybody is entitled to health care. And I believe that all of us are entitled to good life, good well-being, and health, and good health and basic amenities, just as healthcare as well. Yeah. So you see, the place is really far. And so this one, so you have to put the motorbike in a boat. So they are going to the first video I played. So yeah, they are going to the village, and then there's someone at the end of the river dragging the boat. So it's not like you're paddling it with a canoe. You have to drag it to get to your destination. And I'm really proud of my volunteers because we take this very seriously, and we are putting our life at risk to make sure that people get the necessary help they deserve. Okay, sorry. So this is how massive the river is. And also this is our volunteers. So they are going to another rural community, and this is the only means of transportation. So you have to use the this means of transportation to get to the community to talk to the women and sensitize them. And this, I think I have a problem with this video. It's refusing to play. So yeah. So this is our volunteers giving us free clothes in the marketplace. And then at the end of the day, we speak to them, make sure they are in sync with whatever we are telling them. And this is the male sensitization I talked about. And this is our volunteer, our Northern Regional Coordinator, educating the men about maternal mortality and reproductive health as well. And this is one of our volunteer. She is thanking God for her mercy, for his mercies, and the valuable health sensitization they have received so far from Global Impact for Rural Innovation, especially on cervical cancer. And their major challenges they face has always been long distance to health facilities and financial constraints. And they're calling on the government and NGOs to help improve this access to healthcare facilities and provide HPV vaccine for everybody. So she's just speaking in her language, which is Hausa. And conclusion. So we intend to bridge the gap in rural areas. It requires a holistic approach, and by investing in HPV prevention, improving maternal health services, and embracing digital solutions, we could all help women living in the rural communities. And with the right strategies in place, we can empower rural populations not only with healthcare, but we could also bring out innovative ideas from them. And we are open to partnership and rural advocacy. Thank you for listening. Please, if you've got any questions, just let me know. Thank you. And these are my social media handles, just in case you want to connect. These are my social media handles, just in case you want to connect with me. Thank you. Please, have we got any questions? Hello?
Hello, can you hear me?
Yes, I can hear you, please.
I'm Dorothy Oko, the founder, I would say, of Preventive Healthcare Initiative. And we're also involved with women's health, more of women and child health.
Okay.
And prior to this time, we were actually involved with cervical cancer screening. Maybe after this, we'll still talk to, communicate, and then we get to know more.
Okay.
I was going to ask about your HPV, the cervical cancer prevention. Are you do you screen them and what method are you using?
So the last screening we did, we used VIA to screen them.
Mm-hmm.
And due to lack of funding, we've not done any screening again, but we just do a health sensitization for them.
Okay, but okay, you don't screen and treat, or you screen them and follow up. What do you do exactly?
So
For
the
those who are positive,
last
what do you
one we did in the South, we screened and we helped in treating them. So for the three that are positive, some didn't go back to the hospital, which I think is our fault because we didn't follow up as well. So that's where we are lacking as well. We need to follow up with the preventive measures.
Okay. Well, thank you. But the immunization, I don't know, the rural area, you didn't quite mention where exactly.
Yeah, so the rural areas, we've got branches in River State, in the rural communities. We've got in Okrika, we've got in Ikwere local government, we've got in Falga, and then we've got in Enugu State, we've got in Bauchi, we've got in Jigawa, and we are in Jos, but we are not really in Jos, so we are not really stable there. And then we've got in Bayelsa as well.
Okay, because we are in River State, so I don't know.
Yes.
Preventive, okay, maybe you go. Okay, I don't know whether I've heard about it. So we are more now on preventing anemia in pregnancy, trying to make them, safe and all that.
Okay.
So what we do basically is to give them some maybe multivitamins, talk to them about preventing anemia and all of that. And then because first of the women, they are usually more than 50% are anemic during pregnancy.
Yeah.
And they don't have access to most of these basic medications and all that. So we talk to them about nutrition and all of that. And so far, that's what we've been doing in collaboration with, before now, we're working with Vitamin Angels. Vitamin Angels, you've heard about them?
Yeah.
Okay, so they were the ones giving us most of the commodities. And then, there are a lot of, if you're in River State, you should go to the rural communities. We've been in, we work in Falga too, or Obiakpo,
Yeah.
and we're working in collaboration with the primary health care. And then Ahoda West and Ahoda East, a lot of teenage pregnancy. So you need to really talk to them about it
Yeah.
and basic health issues. So thank you very much. I think you're doing a very good job. Okay,
Thank you.
great.
Thank you. The goal
Yeah.
is to make sure at least we reduce teenage pregnancy as much as we can within those rural communities. And also, if it's possible, because we are trying so hard to make sure that the teenagers within the rural community also get the HPV vaccine before they become sexually active. So,
Vaccine, okay.
yeah. So, yeah. Please, have we got any other question? Thank you so much, Dorothy.
Okay, thank you.
So,
Hello, my name is Olufunke. I'm the founder of Beautify Life Foundation. Way more into breast cancer, but I just want you to explain more about when you say health sensitization. Is it more
Okay.
about you educating them, or what do you normally do?
so what we do the first time is we educate you in your own language. And then after that, that's the sensitization. Then after that, we go back to screen. So we do two things. So we sensitize you first to make sure to give you that assurance that we're not coming to kill you, but we are coming to help you, which is the sensitization and education. And then we go back, when we've gotten your approval, then we'll go back to screen.
Okay, thank you.
Yeah. Please, have we got any other question?
Okay, sorry.
So Dorothy, please, how do we connect? Are you on any of my groups? Please, have we got any other question? I'm recording the session, so I could send it to anyone that is interested to have a listen through. And also, if you're interested in partnering with us for our 300 She Live Defense project, please reach out to me on my social media handle. And I would like to say thank you all for joining. And if there's any opportunity at all where we could help women within the rural community, give them the help they deserve, give them the awareness they seek, please let's work together, and so we could gain their trust, and then we could help and render service to humanity. Thank you all so much for joining, and I wish you all a lovely evening. Take care.
Thank you. Thank you.
you. Bye-bye.
Thank you, Priscilla. Bye-bye.
Thank you. Bye-bye. Bye.